Now our final expert, Dr. Raj Dasburmak, consultant ophthalmic plastic surgeon.
Hello.
Hi.
So what have we got here today?
So this is Rachel. Rachel came to me complaining of excess skin on her upper lids. It was causing the skin to rest on the lashes. She was having problems with tearing of the eyes because the tears were wicking out to the outer edge. She also felt that she had a tired look about her, and she was using her brow to try and keep her eyes open. And so Rachel's come to me just to have the upper eyelids assessed and treated. Now, if we look at Rachel, if we look at the left eye here and we expose the brow, if we negate the power of the brow, we can see that actually there's a lot of excess tissue here. And if I just pinch it very gently with some blunt forceps, we can see that it's actually a lot of tissue here which actually hood over, and this is particularly pronounced first thing in the morning. So we can offer a simple surgical procedure called a blepharoplasty, where we remove the skin. It's done using a very high frequency radio frequency nerve which cuts and coagulates as we go along. I also address the muscle underneath so that the skin sits flush and you get a good effect from all directions, not just from in front. In the same incision, we can address the muscle that's responsible for the crow's feet as well. So offering not a permanent Botox, but it's effectively addressing the muscles which cause.
So are you doing more of an upper blepharoplasty rather than a lower?
That's an upper lid blepharoplasty. Now, a lower lid blepharoplasty can also be addressed. Rachel really doesn't need a lower lid blepharoplasty, but had she had bags underneath her lids, that could also be addressed, but that's addressed through a hidden incision inside the lid, so there's no scar involved on the outside, and I put a tightening stitch in on the lower lid just to lift everything up. The upper lid incision is actually hidden within her normal skin crease, so if I get Rachel just to look down for me, we can see underneath this fold there is actually a skin crease which exists down there, so all I do is incise into that skin crease and reform that skin crease using self-unraveling sutures, which, if they've not come undone in a couple of weeks, I take those out.
How do you know if a patient is how does a patient know if they're a typical candidate for something like this? Do they come in for a consultation with someone like yourself, and what's involved with that?
Stephen, what usually happens is patients usually fall into one of two areas. They usually come in either to have a rejuvenation of the periocular area. They may be feeling tired, they may have some excess skin or wrinkles in that area that may need addressing, or they've got visual problems. The hooding can get so severe that it rests on the lashes point downwards, or they just can't see at the top, or they end up using their brows in order to try and keep the eyes open. So those are the typical patients who come in for upper lid blepharoplasty. Lower lid, it's usually bulgy lower lids. It's aging them unnecessarily, so it's just refreshing them.
It's a very safe procedure.
Now, it can be it is a safe procedure. You've got to know what you're doing. Now, it's a procedure which is best handled in the hands of somebody who's trained in eye surgery, so an ophthalmic plastic surgeon. No procedure is ever going to be 100% safe, but you've got to have the procedure done by somebody who knows how to deal with any possible complications. Complications are very low, but they can be serious, and so you must go to an expert in order to be assessed fully. You must have a full ophthalmic assessment in the first instance. And my default status is to say, I'm not going to operate, you've got to convince me to operate on you, and provided it is safe to proceed, we make every assurance that we can to try and perform the safest possible surgery.
Well, I think that's some great advice.
Like originally when people started doing it and they'd get that pulled look, you can do it and people can look natural?
No, it's very interesting, because I have patients who come to me who've had that surgery done, and I have to redo that surgery because they often have patients flying in from abroad because they don't want to get their surgeon in their own country. So they come here to have corrective surgery, and I don't like that look, because in ophthalmic plastic surgery and eyelid surgery, if you take away too much skin, you artificially age somebody. If you take away too much fat, you're going to give them a gaunt look. So less is more, and I really don't like that Hollywood stare. So less is by far more.
Yeah,
I think that's some great tips. Thank you so much for that. And you know, the viewers at home, if you are interested or considering any of these cosmetic treatments, then please go to the website myfacemybody.com.